My name is Andrew Snyder. I'm a family physician in Ashland, Wisconsin. I practice full-spectrum family medicine care. I think the benefits of working in a rural community are that you feel part of the community. You go to the grocery store, people see you and know who you are. In that level, you're just their neighbor. Of course, they know that you're the doctor, but you're able to see them and interact with them on a very basic level. That can be challenging at times, but it's also extremely rewarding. And it's fun. It really makes you feel this is what life is about, and this is why I came to the community.
My name is Christina Marshall, and I'm the coordinator for the Obstetric Fellowship at Essentia Health. The goal of the fellowship was to provide family medicine physicians trained in obstetric care to be able to provide C-sections in rural hospitals. Candidates for our OB fellowship are current family medicine residents and family medicine physicians looking to be able to provide obstetrics, including C-sections, in rural hospitals. The fellow can expect to spend 20 weeks in obstetrics. They will have 12 weeks in a rural community. They have 4 weeks of emergency medicine, trauma. They have 4 weeks of critical care, and then they have 8 weeks of elective time.
Coming out of residency, I knew I wanted to be a full-spectrum family physician. I saw the fellowship program as a chance to take my skills to a higher level. Specifically, C-section training. I was able to do many more C-sections than I ever would have been able to do during residency. I was able to take electives in critical care, management of patients on ventilators, being able to do such critical care skills as placing chest tubes, placing central lines, placing arterial lines. In addition, I did some work with urologists, and I became more skilled in performing vasectomies. All of these skills I'm able to take to the rural community to provide a higher level of care.
The importance of the training and the fellowship for the family medicine physician is they get additional skills before going out to a rural community so that they're able to provide full spectrum care, be able to stabilize patients before they have to be transferred, being able to keep patients in a small community rather than having to transfer them to a larger facility.
In rural communities, the aspect of being able to provide obstetrical care is integral to family medicine. Without this, our patients would be traveling about an hour and a half to deliver. And without being able to provide C-sections, there's no way that we could provide obstetrical care in the community. As hard as you try to predict what's going to be complicated and not, there's no way to do that. And we have to have physicians in the community that can do C-sections if any doctors are going to provide obstetrical care there.
An important aspect of the OB fellowship is training the physicians on the management of the C-section decision. It's important they get this training in the fellowship, as typically in a residency you're getting more of the technical skills. You are called in on the C-section to do the actual procedure and don't get to do the management of the patient and when to make the important call.
I think the fellowship helped me transition to everyday practice because when you come out of residency, you're obviously under a high degree of supervision. During the fellowship, I was certainly supervised, but it allowed me to, and I was forced to act more independently. The fellowship requires you to teach. I spent a lot of time teaching residents, teaching medical students during the fellowship, and assuming that leadership role. Thus, when I went into practice, I didn't feel as much of a novice. I felt as though I was a more seasoned provider.
After graduation of the fellowship program, you will be able to obtain C-section privileges at a rural hospital, and you'll be able to go into rural practice ready to take on anything that comes your way.
If you're a family medicine resident thinking about taking the fellowship, I would strongly encourage you to do so. The skills that I was able to gather during the fellowship, not just surgical obstetric skills, but taking care of general obstetric patients and becoming more comfortable taking care of high-risk obstetrical patients, are integral to my ability to coordinate that care in my rural community.